Hi, welcome back to Q&A with Dr. Q. And today's topic is there a shortage of veterinarians and veterinary team in a pet hospital? Like any other healthcare profession, whether it's a medical profession, you hear that on the media all the time, that there's shortage of nurses, doctors, dentists, and other professionals. So our profession is not any different. Yes, there is an acute shortage of veterinarian and veterinary technician and the team. And now, why is important? As a pet owner perspective, that's important because if you have noticed in the last 3 to 5 years that when you call your veterinarians, you don't get the appointment for your sick pet the same day. And that's a reality. Also, a lot of the emergency veterinary clinics, they have shorter hours, they're closing, they don't have the proper coverage at night. Even if you call your own vet, you don't get the same day for your sick pet. Also, a lot of the pet hospitals, they have reduced their hours. That's definitely concerning for the pet owners out there. They must be wondering what's going on. As for pet hospitals, a veterinarian and the team perspective, that is causing a lot of stress for the team because, vet hospitals have to shorten their hours, is affecting their business, affecting the well-being of the team because there are not too many vets available and they have to work more hours, they have to see more cases, and it is stress all around. So definitely we can say that's really an issue as far as the pet owner's perspective and also the pet hospital team perspective. Why this is happening? Why now? So there are different things responsible for that. Number one, the pet ownership outpaced the graduating veterinarians in North America. And what I hear is, and what I research is, that is all over the world. So people are having more pets, especially it happens in COVID. But as far as the new veterinarians are graduating from the vet schools, is not keeping up with the pace of that. So number two, that most of the senior vets or baby boomer vets, they are retiring. And there are not enough vets to replace them, to take the ownership or come back in stream to take that role. The vet schools in North America, they are not graduating as many vets, and the pet ownership has definitely increased, so it's not keeping up with the pace. Number three, a lot of the vets in underserved rural areas, for example, in Ontario and Canada, northern areas, eastern part of Ontario, not too many vets because it's new grads, they want to have the lifestyle. They want to stay in the busy area. They want to stay in GTA or main areas where more socialization there. So a lot of the rural vets are suffering because nobody want to go to those areas, and pet owners have to travel miles to go to a vet practice to get those services, and that's really causing a lot of stress for the pet owners. And also the practices who are in the rural area, they are not finding the help. They are getting loan veterinarians from other areas. They have to pay a higher fee for that, and that's increasing up their costs and everything. So another point in this, the same topic is that over the years, there is a gender shift in the veterinary schools. When I graduated, there were 85 male veterinarians to 15 female veterinarians. Now is the opposite in the class. What that means, there are more female veterinarians. Sometimes they have to leave the profession temporarily to start a family, or sometimes permanently they leave. So leave a big gap in between that. So that's also a huge impact on this. When I graduated over 30 years ago, I sometimes worked 5-6 days a week. Number of hours, I don't know how many hours I work in a day. And most of the vets, they have a different perspective on work-life balance at that time. But now, most of the vet hospitals, to new graduates or the people who are working there, they want to have a 4-day work week. They want to have 2 or 3 days off. They want 3 to 4 weeks holidays. So due to that, there are not enough hours to cover and to provide those veterinary services. Also, there's a lot of burnout. Vets are working hard. They're dealing with the stress of the pets and pet owners, and so they get burnt out, and they kind of leave temporarily or they leave permanently. They don't want to be in that profession. So all the factors I have mentioned, that's causing a big issue with shortage of veterinarians. Now, what the profession is doing about it? First of all, in last 3 to 5 years, finally there's recognition. So profession like here in Ontario, Canada, Ontario Veterinary Medical Association, the CVO, the College of Veterinarians of Ontario, Canadian Veterinary Medical Association, and even the US, they are finally recognizing. There are panels on their association who are studying this, and finally they have recognized this is a real issue. So what some of the veterinary colleges have done is they started to increase the enrollment. Here in Ontario, Canada, they have added 20 to 25 more seats in the Northern College, which is affiliated with the University of Guelph for Ontario Veterinary College. So increase those seats, but that's going to pan out next 4 to 5 years. But they are thinking about it to increase the enrollment. They're encouraging the foreign trained vets, and they come to Canada and increasing the immigration for veterinarians to come and get licenses and training and everything so they can fill up the gaps. I've seen over the years that now almost 25 to 30% Ontario veterinarian, and even in general in Canada, they are foreign trained vets. The association's licensing bodies are offering restricted licenses. So if you pass the initial exams, they will give you a restricted license till you are fully licensed, so at least you can provide preventative care. And so you can be still valuable to your team rather than doing something else and waiting for your license or waiting for your exams. You can be more valuable for the team. Also, there's some financial incentive that the practice owners are giving to the vets to stay longer in the practices so they can be more valuable. I know a lot of the retired veterinarians are coming back to provide the preventative care because they may not be up with the latest diseases or latest trends and everything, but they're coming back to help the vet practices in preventative care and providing some of the services which are taking the load off some of the vet hospitals. Thank you. Please subscribe to my channel. If you have any question, you can leave your comments below. We can send some links to the association where there is research going on in this topic, so you can read more about it. Thank you.
Are you interested in becoming a vet, opening or running a vet practice, or maybe just looking for professional pet care advice? Visit businessofpetcare.com. Like and follow for more content from the Business of Pet Care.